You can take any religious aspect out of it. You can take any cultural aspect out of it, honestly. Regardless, if you were to look at how people define intercourse, it starts with a man's erection and it ends when a man ejaculates. So sex is defined, like, for a lot of people, biologically by a man's orgasm. Nothing to do with, like, if a female has an orgasm, great. Yeah, that might happen in there. That's cool. But really, the definition of, like, intercourse and the end of intercourse completely has to do with the man. That's it. It's their orgasm. That's it. That's how it's literally, like, often defined.
Yeah, and medically defined that way.
Yes, and yeah, exactly. Like, this is how we know that the beginning is erection, insertion, the end is when the man ejaculates. Then sex is medically, biologically done. It's literally defined by what the man's doing. That's crazy.
What do you call it for your patients?
So you talk about intercourse, which I don't define as necessarily ending with male ejaculation. It ends when it ends. But
yeah,
I also use the phrases like outer course. You're talking about external stimulation, particularly for women. Like, because sex is not just intercourse, it is other things as well. But it's interesting because we define sex usually solely by the result being a man ejaculating, whatever kind of sex you're talking about, whether you're
or the man penetrating.
Yeah, right. The end point usually is the man's done. And for a woman, it's like, well, hopefully we get there. Maybe we will, maybe we won't.